Hello everybody! Today we'll talk about different body types. At a first glance, it may not seem very important, but once you learn what type of physique you have, you will be able to select correct and adequate training for yourself. Nutrition and training strategy depends on your body type. Each one of us is beautiful in our own unique way, with our own traits and characteristics. Body type will depend on the development of the bone, muscle, and fat tissues. For the most part, of course, it depends on the genetics, but you can change your body with proper nutrition and training. There are several ways to determine female body types. We will look into the two main ones. A commonly used way sees three types of female physique: asthenic, normasthenic, and hypersthenic. How to determine your type? It's very simple. You just need to measure your wrist. If it is less than 6 inches, body type would be asthenic. If your wrist is between 6 and 7 inches, body type will be normasthenic or mesomorph. 7 inches or more would be for hypersthenic or endomorph body type. If your body type is asthenic or ectomorph, then the way it is most commonly agreed upon, you will be a lucky woman with a slender and thin physique. According to other ladies, you're some kind of witch who eats whatever she wants and does not gain weight. On the other side, while those women are usually slim in their youth, with age they tend to gain fatty tissue where they least want it, while the muscle mass is declining. That combination can create an unproportional silhouette. General characteristics of an asthenic type of physique include thin overall constitution, small joints, narrow waist, long and thin bones, low percentage of body fat, and fast metabolism. The biggest challenge for an ectomorph is the increased metabolic rate, which prevents them from gaining muscle mass, or at least a lot of muscle tissue. Ectomorphs start gaining muscle mass only after lengthy and intensive training, and even then, an ectomorph's body will not look the same as a mesomorph's body. While following a workout routine, it is crucial for ectomorphs to be very careful with their nutrition plan. If they're not receiving enough nutrients, it will be quite difficult to see any results. Cardio exercises will be eliminated or brought down to a minimum. Ectomorphs tend to have high levels of energy, which can make them anxious and hyperactive. Sometimes people with that type of physique are even prone to insomnia. The risk of overeating is low for ectomorphs due to their fast metabolism. High-carb diet is recommended for ectomorphs since their bodies generally don't store it as fat and rather transform carbs into energy. It is easier for ectomorphs to be in a good shape since their bodies usually don't accumulate lipid tissue. Those are girls with lean physique. It is difficult for them to get muscle mass. A typical top model on a catwalk is an excellent example of an ectomorph woman. Short upper body and longer limbs create an illusion of extremely long legs. Low level of lipid tissue is usually reflected in breast size. When it comes to working out, it is easier for ectomorphs since they barely ever have to work hard on losing weight. A woman with an ectomorph body type can start off with split system training and should avoid cardio exercises. After achieving desired results, they will need to go through the cutting process. When an ectomorph loses weight, first she will see a decrease in muscle mass and only then in fat tissue, even though usually there is not a whole lot of it there. That is why the best thing for ectomorphs will be a good strength training combined with a diet with calorie counting and proper nutrients to prevent gaining of fat tissue where we don't want it and to achieve a beautiful definition. Ectomorphs need to take very good care of their joints and ligaments, so make sure to warm up before working out. Ectomorphs' joints and ligaments are prone to trauma. If a woman who is an ectomorph wants to do bodybuilding, she needs to make sure to do a lot of strength training rather than any cardio. The whole training program should be based on the split system training. It is recommended to work out no more than 3 times per week, and keep in mind that rest days are meant for actual rest and relaxation. Give your body time for proper recovery. It is recommended to work out for 50 minutes or less. Long workouts like 2 hours or so are a big mistake for a woman who is an ectomorph because this is when glutein in the muscles starts burning up and at the end, you will not get the result that you were aiming for. That is why strength training is recommended in moderation. Make sure to give yourself time to rest and recover and consume enough nutrients. You will need to close an anabolic window after your workout by consuming protein. Next type is normosthenic or mesomorph type. Usually mesomorph women are quite athletic, and sometimes we get an impression that they can get muscle definition simply by looking at free weights. Mesomorphs tend to have quite fast metabolism as well, combined with good appetite. For example, if ectomorphs tend to have fast metabolism and poor appetite, mesomorphs are more likely to have better appetite with fast metabolism. That's what allows them to gain muscle mass quickly. Statistics show that most of the professional athletes happen to be mesomorphs. Usually mesomorphs can quickly get rid of fat and gain muscle mass. While their metabolism is fast, when mesomorphs age, metabolism slows down, and without an appropriate training program, mesomorphs' weight will rapidly go up. Torso is normally slightly shorter than legs, so the legs wouldn't look too short or too long. The body would look pretty balanced. They usually have average-sized chests, wrists, and feet. A big advantage of this body type is that it requires less time to recover after working out. That is why mesomorphs can train 3, 4, or 5 times per week, unlike ectomorphs. That is the strategy for training for mesomorphs. The more they train, the better the results will be, and the better and more beautiful definition of their bodies they will be able to achieve. Common characteristics of mesomorph physique are athletic body type, low fat levels, combined with defined muscles, average or large bones, wide shoulders, and well-developed ribcage, fast metabolism, and good strength indicators. Next body type is hypersthenic body type, or endomorphs. Endomorphs are more prone to gaining extra weight. That body type is very common among Europeans. People with that body type tend to have slower metabolism, sweet tooth, and sedentary lifestyle. It leads to gaining subcutaneous body fat even when calorie intake is normal. Endomorphs have to be strict with their nutrition and keep an eye on the glycemic index of the products that they are consuming. Regular cardio is highly recommended. The fastest way for an endomorph to lose weight is a full body training program. So the strategy for losing weight is balancing cardio and strength workouts with weights. Endomorphs are characterized by having thick limbs, stocky builds, relatively short arms and legs, wide rib cage, wide waist, wide hips. Endomorphs usually have large bones. They usually have more fat tissue than muscle from birth, but that does not mean that an endomorph will always be overweight. With sufficient exercises, the endomorph can look quite fit. The training strategy for this type consists of intensive cardio, strength workouts with weights, combined with a low-carb diet. Split system training is recommended, 2 to 3 workouts in a row, then a day to recover. While training, first do strength exercises, then cardio, then endurance training. Stick to that order. That approach will ensure you will gain muscle mass as well as burn fat tissue. Those were the basic principles on which we base the training strategy for endomorph. Another indicator worth looking at is a muscle belly to tendon ratio. While lifting weights can make our muscles thicker and longer, the length of our muscles in relation to our tendons would stay about the same. If you flex your arm to 90 degrees, your palm facing your bicep, you should see where your muscle belly ends and tendon begins. If your muscle bellies are smaller, if they contrast sharply against the tendons right next to them, and there's quite a distance between your muscle belly and forearm, it indicates an ectomorph muscle to tendon ratio. If the tendon is not as long and muscle belly is larger, it indicates a more mesomorphic muscle to tendon ratio. If there's barely any space between your bicep and forearm, it indicates an endomorph muscle to tendon ratio. We went over the first system of defining female body types: ectomorph or asthenic, mesomorph or normosthenic, and endomorph or hypersthenic body types. In the next video, we will look into a different approach to define body types.